Hello everyone, I'm Dr. Afrin Rajai, and in this lecture I'm going to talk about MRI systemic therapy. MRI therapy created by Mental Research Institution, also referred to as Palo Alto Group, and they developed it in the back 60s, and then after this Milan systemic therapy and strategic therapy by Jay Haley, they're really calm and inspired by MRI therapy. So when we are talking about systemic therapy, MRI, Milan, and strategic therapy, what are we talking about? So in all of these different systemic approaches, therapists look at the system and the whole family and the whole system, and they try to really understand what's going on, different patterns, different interactions, different dynamics, and then they try to introduce small or really alternative small changes or patterns or interactions to the system, and then they kind of allow the family or the system to reorganize themselves naturally. So a systemic therapist do not say, hey, this is what I see and this is not healthy, this is not functional, this is a symptom that is dysfunctional and you need to change this. Like with all these different huge techniques or interventions, that is not how they think, how they work. They really try to understand and study the system very well and tell them, like, help them find these small and meaningful alternative changes, and then give them time, give them different resources so the family, the whole system can naturally get reorganized. Process of therapy with this approach, MRI approach. So in therapy, we are always thinking about change, right? So clients, they come to your office because they want to see some sort of change in their lives, in their beliefs, or in their relationships. And all of us as a human being, we have a definition of change. We have a way of looking at change in our own lives. And as a therapist, with the approach that you take and you have a specific way of looking at change. So in MRI therapy, the changes that would happen through treatment are classified as first order change and second order change. And in the next slide, I'm going to talk about them in more details. But just for now, know that first order change is about family patterns of interactions and they are about altered at the behavioral level only. And second order change, they are about the family rules or underlying beliefs that maintain or govern family members' behavior or promote specific reactions that are altered. So again, like I'm talking about first order and second order change just in a second in the next slide, but just for now, let's focus on the steps or the process of MRI therapy. So the first step in or the first thing that you would do as a therapist with this approach is that when you have your clients, the family or the couples or your clients in your office, you really want to know how they define, how they understand the problem in their own world or language. How do they define that? So you would ask them, why are you here, right? And then if they are in any ways they are vague in a way that they are expressing the problems. Let's say they just say, oh, we just don't get along, right? That is vague from a therapist who has MRI approach or who take that approach. So if they say something like that, then you would ask more questions until they tell you something that is clear and specific. So for example, a couple may tell you, we are here because we can never have conversations, we can never have communication, we cannot communicate with each other. Every time that we're talking about something, it just turns into a fight in 5 seconds, right? So that is a problem from their perspective, that they don't have any communication. Then the next step is that you want to define the problem, but with the MRI approach, that is really specific about this approach, and it's beautiful that they try to define the problem in a really relational and interactional way. It depends on it. They really consider the interactions in the system, and they try to reframe the problem in a unique way that is understandable for the family, the system, and fits with the system, and at the same time it's relational and interactional. So they really try to have a sort of like a prediction or estimation of the behaviors maintaining the problem. So certain behaviors or interactions among family members are assumed to be maintaining the problem, and you as a MRI therapist, you try to observe of the family interactions, and try to see how these interactions they continue. They have to do with a problem and should continue until you as a therapist again have a clear picture of reinforcing behaviors, right? Why these interactions they are continued. Then after this step, you want to set goals with clients. And usually one of the good questions that you can ask is, what will be the first sign that things are getting better for you, right? So once the problem has been defined clearly, you as a therapist and with the family, you start negotiate goals for change. Goals should be measurable, and you should be they should be observable. And to help quantify the goals, the therapist might ask questions, as I told you, like what will be the first sign that things are getting better. Then after that, you want to review attempted solutions. So you want to explore with the family, with the system, previous attempts to solve the problem. It's always helpful to know what solutions the family has already tried for several reasons, or several years, months, and the behaviors associated with attempts at solving the problem may be maintaining the problem. So knowing the attempts the family has made helps you as a therapist avoid strategies that repeat the family's efforts and points to other strategies. So and usually there are three general types of solutions that family may have tried, and each of them it suggests a specific intervention strategy. So when you're working with the family, with the system, they may tell you that say something that it's about denial, right? So they denied a real problem, ignored evidence of drug abuse in a teenager, right? And then suggest an intervention that gets the family to act. Or they may tell you that they try to solve a non-existent problem. So for example, they punish a toddler for masturbating, right? And in this situation, you need to get the family to stop acting. Or they may tell you that they taken the wrong action. So for example, they bought gifts for your daughter instead of giving her attention. And in this situation, you need to understand that one of the things that could be helpful is a different action, right? So, and working on that with the clients. So that's when you kind of try to review the attempt solutions, and that is how it's helpful for you as a therapist. Then you try to have some sort of intervention with the clients and with the family, and we're going to talk about that in more details in the next slides. But as I mentioned before, the type of problem and the solutions previously attempted suggest particular strategic intervention, right? And some of these interventions, just for now, in general, they include reframing, paradoxical interventions, and itself include symptom prescription or positioning. So all these different things that, again, like we're going to talk about them in more details in next slides. But that is, the next step in the process of therapy, as with the MRI approach. And then you work on first order and second order change. And as I mentioned, I talk about those things in the next slide. But again, like it's about changing patterns, roles in a family, or underlying beliefs, and kind of like more fundamental changes in a system. And then it's about termination and having a plan for maintaining the new behaviors in that system. two types of change in MRI therapy: first order change and second order change. First order change is about change in roles within the system, and the basic interactional patterns stay the same. And second order change is the key for MRI approach, and it's very fundamental, right? So these fundamentally changes rules for relating in the system. And MRI believes that these changes, second order changes, they are necessary for problems to be solved, right? So if you want to talk about some examples, first order change if when you have a couple in your office and they're talking about how always one partner is like the boss, and is bossy and calls the shots in a family, and then the other partner is just obedient, right? So first order change is helping them to sometimes, for the partner who is obedient to be the boss, and for the partner who is the boss to accept influence and be obedient, right? So that is about changing in roles within the system. And then for the second order change, you dig deeper, right? So you find some sort of changes or rules that can be helpful, kind of like causes of some of these problems, and would help them with the main and focused problem to be resolved. So here are some points about first order and second order change. Most of the time in therapy, we are talking about second order change. Really, our goal would be second order change because it's just fundamental, right? But MRI therapy believes that sometimes first order change is acceptable and is enough. Like in the example that I told you, if one partner is always the boss, or bossy, and the other partner is obedient, if they are changing the roles sometimes and they're happy with that, that can be enough, right? And the other thing is that sometimes, most of the time, or typically, first order change comes first, but that is not all the time, that is not for always. So those are the things that we need to remember when we are talking about types of change in MRI therapy. Therapist with MRI approach is really respectful, and it's all about trust in the system. So the therapist with this approach would be respectful to the point that they take the position that is most helpful to the family system and its needs. So therapists should adapt to the client's language, viewpoint, and be very flexible in this approach. And some mentors and some of the big names in our field believe that the most challenging part of, or one of the most challenging part of MRI therapy or approach is about practicing to see the systems and not individuals. Even when you have an individual in your office, not just see an individual, but like not just have that individualistic perspective, but have a systemic perspective. And that is sometimes really hard because a lot of times we are socialized and conditioned to see these linear relationships, right? So A, cause B, and this happened because this person said that, blaming, see whose fault it is, right? And seeing the system truly is not about that at all, right? It's much more complicated, and it's about all these different contributing factors and relational factor that for a lot of people and trainees and students, it takes a lot of time to adapt to this sort of perspective and approach, because again, like all of us, we are 20, 30, 40, 50 years old, and for a long time we are just so used to see linear causation, and again, like just A, B, C, and B causes D, and that blaming perspective. So that is really something that you need to, as a person, as a therapist who takes this approach, you really need to practice a lot and give yourself time and use a lot of consultation and mentorship and supervision, so you become mindful of your blind spot when you are working with system, and when you want to see this true when you want to use MRI approach in a true way. So MRI therapy is not about blaming at all, right? It's just about contributing factors and seeing the system in a clear way. In order to understand case conceptualization in MRI therapy, we need to be familiar with the principles that they have. So as you probably know, MRI therapy, in MRI therapy, it's not about normative patterns of development, or it's not about using a specific criteria to measure how healthy it is one family or one system, right? They're not concerned with changing the whole like organization of a family. They're more focused on the faulty cycles of interactions that are usually set into motion but by misguided attempts to solve problems. So instead of solving the problem, it's not about fixing the problem, right? It's about the family's attempts that can maintain or worsen it, right? So problems are not viewed as having linear causes. Rather, a problem behavior is just one point in a repetitive pattern. So it's about cycles, it's about systems. They have different MRI therapies are guided by the principles of cybernetics. So cybernetics is the study of how information processing systems are self-correcting, controlled by feedback loops. And feedback loops are the mechanisms or cycles of interactions through which information is returned to the system and exert an influence on it. There are both negative and positive feedback loops. So negative feedback loops are always that are ways, that families correct deviation in family functioning so as to return it to a previous state of homeostasis. Positive feedback loops arise as a family attempts to add new information into system. This can occur as a part of the growth process or increasing levels of complexity in a system, right? So positive feedback loops are assumed to be responsible for the development of problems in families as they attempt solutions that worsen or maintain the problem. For example, let's say if a child misbehaves, right? So if we have a child that have some sort of misbehaviors or misbehaves, so that is, in the family problem would be deviates from the norm. This child is not normal, right? Because they are jealous of a new sibling, and the father responds with harsh or punishing behavior, right? So when you ask clients, remember we talked about the process, and one part of the process is that you ask clients about past solutions that they had, right? So when you ask for that, they say, oh, the father, they try to use timeout, or they limit the screen time when this happened, or remove the screen time, kind of like the privilege that the child has, right? So when they respond with harsh or punishing behavior, which is an attempt solution, it confirms the child's belief that they are not loved, or they are loved less, right? And their behavior worsens. So that is like the deviation is amplified. And MRI interventions would be aimed, and the goal is at changing the pattern of interaction so that the father could help the child calm his behavior or their behavior and show them that he is not loved less, or he is loved, right? So in the process of case conceptualization, MRI therapists, if it's possible, they would use observational team, and some other approaches they use the same concept. But in MRI therapy, the therapist is with the client, and there's this team who would observe the session, and they are back usually like with two-way mirrors, or the sessions who are with the consent of clients, they are recorded, or they have cameras, so they are the other room watching the session. And after maybe 30 minutes or so, the therapist would come out and consult with the observational team. The reason that this is really helpful is because a lot of times when you are in distance with something, you are not very close, you're observing, you have a better chance and opportunity to see patterns, to understand the system, and that is why they use this concept. mentioned before, MRI therapists, they're looking for symptom-free interaction patterns. And for that, like we talked about this in the process of MRI therapy, they try to talk about a problem, and the problem is an attempt solution, right? So they try to define the problem in a very behavioral way, and they try to identify attempt solutions, and they try to ask clients, what would you see? What is the first sign that you notice if, the behavior or this problem is changed, right? So they talk about desired behavior change, and then they come up with a plan. Again, like as we mentioned, it's not about fixing the problem, it's about a pattern, right? So they come up with a plan for that, change or goal that the clients have, and they try to really use the client's own language for that. Interventions that the therapists use in MRI therapy. So the first one is reframing, and there's this quote about reframing that says the use of language to give new meaning to a situation. This may lead to changes in interactions, reactions to behaviors, which can be first order change as we talked about it, or to the alteration of rules that govern behaviors, which is again about second order change, right? Remember we talked about it a few seconds ago. So reframes do not necessarily have to reflect the actual truth of the situation. For example, an angry teenager who has been locked out of the house by, his father, may be told that it's the only way the father has to demonstrate his love, right? So armed with a new way to interpret his father's behavior, the teenager may then change his behavior towards the father, who may in turn soften his behavior towards the son. MRI therapists have been criticized for an overly pragmatic approach in which any reframe that might lead to a change was allowable. So that is a criticism that we have for this intervention. As a result, they have increased their efforts to be sensitive and respectful in the formulations they offer to families. The next intervention is paradoxical intervention, and it's about asking the family to do something that seems in opposition to the goal of treatment. So some of the mentors, they believe that as strategic therapy models have evolved, the use of paradoxical interventions has declined due to necessarily use of deception. For example, symptom prescription. So the family is requested to continue to perform or even expand the symptom. The intervention may be compliance-based if the therapist wants the family to do as suggested, or it could be defiance-based when he or she wants the family to defy the directive. The other technique could be restraining techniques, and in this technique, family members are warned of danger of change or dangers of change, and they are restrained from trying to change or are asked to change slowly. So the restraint of change technique is used when the family seems ambivalent about changing. The therapist aligns with the side of the ambivalence that resists change, so that the family will align with the side that they wishes to change. So for example, if you have a client who thinks who they have obesity, right, and they come to you and they are talking about how often they try to work out or have to have a specific diet, and then it's hard because at the same time life is just short and they need to enjoy it, then you as a MRI therapist would tell them, yeah, of course it is. You should never try working out. You should never try this specific diet that the doctor prescribed for you. Of course not, right? And when they do that, they believe that emphasis would help client to use the other kind of like that to goes towards the desired change. The other intervention would be positioning, and in this intervention, the therapist exaggerates the family's explanation of the problem to a point that the family will disagree. So, so if you have a family who come to you and the identified patient or client is the child, so they are complaining about the child and how the child is a problem. And you as a therapist, you see that the child seems to be a problem because with that behavior, with acting out, he is trying to, make the couple, the parents, be close to each other, right? You see that, but at the same time, with positioning, you try to exaggerate the way that they are talking about the problem. So you would catastrophize kind of like the way that they're talking about how this child is a problem and how it's just impossible to tolerate his behavior. And with that, the point is with this exaggeration, the family comes to kind of like reasoning that oh, this is not what it seems or what we thought it is. That we talked about so far. Now it's your turn to think about this question. What is the role of culture and diversity in MRI approach? And if you are a therapist with the MRI approach, how you can promote this cultural and diversity perspective and lens in your work. If you have any questions, you can always email me and you can make a comment here on my YouTube channel. Thank you for subscribing.